They say aging means giving up your vitality, but what if they are wrong? What if the loss of sexual strength after 50 isn't a sentence, but a signal? Too many men silently accept decline, blaming age, while the real issue lies in muscles they've never trained, postures they've never corrected, and tension they've never released. It's not about pills, pumps, or embarrassment. It's about reclaiming what was always yours. In this video, you'll discover a medical approach few doctors explain clearly, how specific exercises can restore blood flow, boost testosterone naturally, and awaken dormant pelvic power. No gimmicks, no overnight promises, just a simple, science-based protocol designed to bring lasting results, even if you're starting at 60 or beyond. You'll learn exactly why your body stopped responding and what you can do daily, in just 10 minutes, to reverse that process. These aren't random gym routines. They are therapeutic movements used by clinicians to treat the root causes of erectile dysfunction, prostate congestion, and pelvic fatigue. Knowledge is power, but action is transformation. So if you're tired of false promises and ready to take control, you're in the right place. Subscribe to the channel now and join thousands of men redefining what aging looks and feels like, starting from the inside out. Erections are the result of a finely tuned neurovascular process. The brain sends signals through the spinal cord that stimulate the release of nitric oxide, a molecule that relaxes smooth muscles in the penile arteries. This allows for increased blood flow, causing the erectile tissue to expand and harden. It's not just a matter of desire, it's biology in action. Without proper circulation and nerve function, this chain reaction fails. As men age, several key factors begin to decline, altering this process significantly. Testosterone levels drop gradually, reducing libido and weakening the signal strength from the brain. Nitric oxide production also decreases, compromising blood vessel dilation. The arteries themselves may become less flexible, limiting blood flow. All these changes make it harder to achieve or maintain an erection, even with adequate stimulation. The vascular system plays a central role in erectile function, and aging takes a toll on its efficiency. Blood vessels lose elasticity, and plaque buildup can restrict flow. This makes the penis less responsive and erections more difficult to sustain. It's a warning sign not just of sexual decline, but of broader cardiovascular issues. Monitoring this system is essential for men over 50 concerned with their sexual health. Yet, understanding this decline opens the door to potential improvement. By targeting the mechanisms involved, testosterone levels, nitric oxide, and blood flow, interventions can restore function. Natural ED treatment strategies like specific exercises or lifestyle changes aim to reactivate these systems. In many cases, aging doesn't mean losing potency, but rather learning to work with the body's evolving needs. The pelvic floor is a group of muscles that support the bladder, bowel, and sexual organs. Two key players here are the pubococcygeus and bulbocavernosus muscles. These muscles help control blood flow during erection and ejaculation. When properly engaged, they compress veins to trap blood in the penis. This muscular action is vital for sustaining a firm and lasting erection. Weakness in the pelvic floor, often unnoticed, can drastically affect erectile strength. When these muscles lose tone, they fail to hold blood in the penis efficiently. As a result, men may experience softer erections or difficulty maintaining one. This isn't just a sexual concern, it signals a broader decline in pelvic integrity. Many older men assume it's normal aging, but often it's reversible dysfunction. One common sign of pelvic floor dysfunction is post-urination dribble. After using the bathroom, a few drops of urine leak out. This is more than a nuisance. It's often a sign that the bulbocavernosus muscle isn't contracting well. Just like any other muscle, the pelvic floor responds to exercise and retraining. Understanding its anatomy is the first step to reclaiming control. Thankfully, this system is responsive to targeted movement therapy. Through pelvic floor therapy for men, these muscles can regain strength and coordination. Kegel for men isn't just about squeezing. When integrated with breath and posture, it becomes a powerful tool. Strengthening this foundation doesn't just improve sexual function, it enhances overall pelvic health and confidence. Modern life encourages sitting for hours, often without realizing its hidden consequences. Prolonged sitting shortens the hip flexors and weakens the gluteal muscles, creating an imbalance in the pelvis. This tightness restricts blood flow to the lower body and adds pressure to pelvic structures. The result: poor circulation, discomfort, and over time, compromised sexual function. It's a slow erosion that many men ignore until symptoms appear. Inactive glutes mean less support for pelvic alignment and core engagement. These muscles help stabilize the pelvis, allowing the pelvic floor to work efficiently. When the glutes switch off, pressure shifts to other structures, including the prostate and pelvic floor. This creates strain, weak coordination, and often erectile dysfunction. It's not just about exercise, it's about correcting a deep-rooted postural problem. Increased sitting also leads to stagnation around the prostate, which can contribute to congestion and discomfort. Over time, this can mimic or worsen the symptoms of erectile dysfunction. Reduced pelvic circulation affects not only blood flow to the penis but also hormonal health. It becomes a vicious cycle where less movement leads to more dysfunction and less confidence. Addressing these issues doesn't require intense workouts but rather intentional daily movement. Small changes, like standing breaks and posture corrections, begin to reverse the damage. Targeted exercises restore glute activation, hip mobility, and pelvic flow. For aging men, this shift can reignite energy, vitality, and sexual resilience without medication or extreme measures. Scientific research increasingly supports movement as a core therapy for erectile dysfunction. Exercise stimulates nitric oxide production, improves vascular health, and reduces inflammation, all key factors in male sexual function. Studies show that targeted mobility and strength routines improve erectile quality in aging men. It's not hype, it's physiology. Movement restores what time and stress gradually take away. Unlike medications that treat symptoms, movement-based recovery targets root causes. Improving circulation, hormone balance, and neuromuscular coordination makes a lasting impact. This includes better function of the pelvic floor, spine, and hips, all crucial in sexual health. Clinical data confirms that men who exercise regularly report stronger, more reliable erections. Consistency, not intensity, delivers results. A study published in the Journal of Sexual Medicine found that men with moderate physical activity had significantly better erectile scores. Another trial showed improvement in sexual performance after just 12 weeks of structured pelvic exercises. These aren't miracle cures, they're the body's natural mechanisms reactivated. It's biology responding to intelligent input. More importantly, these interventions carry additional health benefits: reduced blood pressure, lower cortisol, and better mood regulation. Movement taps into the parasympathetic nervous system, the state where rest, recovery, and sexual function thrive. By working with the body, not against it, men reclaim not just performance, but overall vitality and confidence. Scientific research increasingly supports movement as a core therapy for erectile dysfunction. Exercise stimulates nitric oxide production, improves vascular health, and reduces inflammation, all key factors in male sexual function. Studies show that targeted mobility and strength routines improve erectile quality in aging men. It's not hype, it's physiology. Movement restores what time and stress gradually take away. Unlike medications that treat symptoms, movement-based recovery targets root causes. Improving circulation, hormone balance, and neuromuscular coordination makes a lasting impact. This includes better function of the pelvic floor, spine, and hips, all crucial in sexual health. Clinical data confirms that men who exercise regularly report stronger, more reliable erections. Consistency, not intensity, delivers results. A study published in the Journal of Sexual Medicine found that men with moderate physical activity had significantly better erectile scores. Another trial showed improvement in sexual performance after just 12 weeks of structured pelvic exercises. These aren't miracle cures, they're the body's natural mechanisms reactivated. It's biology responding to intelligent input. More importantly, these interventions carry additional health benefits: reduced blood pressure, lower cortisol, and better mood regulation. Movement taps into the parasympathetic nervous system, the state where rest, recovery, and sexual function thrive. By working with the body, not against it, men reclaim not just performance, but overall vitality and confidence. Each therapeutic movement improves blood flow, particularly through the internal iliac artery, which supplies the pelvic organs. When circulation improves, erectile tissue becomes more responsive and capable of sustaining firmness. This isn't just about volume of blood, it's about timing and pressure. With better vascular function, the body can initiate and maintain erections more efficiently. It's a natural enhancement of a biological process. At the hormonal level, these exercises help regulate testosterone. Regular movement reduces cortisol, the stress hormone that suppresses testosterone production. When cortisol levels drop, the body shifts into a more anabolic or restorative state. This favors the release of luteinizing hormone, which stimulates testosterone in the testes. Over time, this leads to better libido, mood, and performance, without pills or injections. Exercise also enhances parasympathetic nervous system dominance, which is essential for sexual arousal. Unlike the fight-or-flight state, this rest and digest mode allows blood to flow freely to the penis. Through breathwork and pelvic engagement, the body shifts into a state that supports erection and intimacy. It's a physiological transition men can train, just like building muscle or improving posture. The hormonal and vascular benefits are not isolated, they reinforce each other. Better circulation supports hormone delivery, while healthier hormone levels enhance vascular responsiveness. For aging men, this synergy offers a pathway to reclaim vitality. With consistent practice, these movements lay the foundation for sustainable sexual health and overall well-being. The key to long-term success with these exercises is consistency, not intensity. A 5 to 10-minute daily protocol may seem minimal, but it creates lasting neurological and hormonal shifts. The pelvic floor responds best to frequent, low-load activation rather than sporadic effort. Daily engagement maintains circulation, coordination, and muscle tone without causing fatigue. For older men, this gentle approach fits easily into any routine. Morning is an ideal time to begin, as hormone levels, particularly testosterone, are naturally higher. A short session of breathwork, pelvic tilt, and glute activation helps set the tone for the day. It also promotes parasympathetic activity, reducing stress from the start. Evening routines can focus on flexibility, such as the deep squat hang or pelvic clock. These movements calm the nervous system and improve recovery during sleep. This structured approach offers both physical and psychological benefits. Knowing there is a clear plan reduces anxiety and builds confidence. Over time, these small habits compound, improving not only erectile function but posture, core strength, and urinary control. It's a holistic system disguised as a simple routine. The body rewards discipline, even in short bursts. By committing to this protocol, men rewire their neuromuscular and hormonal patterns. It's not about doing more, it's about doing what matters most, consistently. A few focused minutes each day can reverse years of decline. The key is to start, stay patient, and let the body respond at its own pace. This is longevity training, inside and out. One of the most common mistakes is over-tightening the pelvic floor. Many men think that stronger means tighter, but this approach leads to tension and dysfunction. The pelvic floor needs balance, both strength and relaxation. Overcontracting can actually restrict blood flow and increase symptoms of erectile dysfunction. Like any muscle, it must be trained with awareness, not brute force. Another overlooked factor is the role of breathing and stress management. Holding the breath or rushing through exercises triggers the sympathetic nervous system associated with stress and tension. This counteracts the parasympathetic state necessary for erection and recovery. Proper breath coordination enhances pelvic activation and calms the body. It's not optional, it's foundational. Poor posture is another hidden disruptor. When the pelvis tilts excessively or the spine collapses, it puts pressure on the pelvic floor and organs. This misalignment makes it harder to engage the right muscles and can worsen urinary symptoms. Correcting posture through targeted mobility and core work is essential. Without it, even the best exercises lose effectiveness. Finally, men must avoid ignoring signs of discomfort or strain. Pain, numbness, or excessive fatigue are not signs of progress, they are red flags. Especially for older individuals, working under medical guidance is key. This journey is about healing and optimization, not overexertion. With care and attention, the path leads to real, sustainable improvement, not just in sexual health, but in quality of life. Before you go, consider joining our channel's Members Club, where we dive deeper into exclusive techniques, updated protocols, and ongoing guidance tailored for men over 50. It's where knowledge turns into personal power, and you're not walking this path alone. The truth is, age doesn't rob your vitality. You give it up when you stop moving with purpose. These exercises aren't just for the body, they are a statement of reclaiming control. Don't wait for symptoms to become regrets. Start today, with 5 minutes, with one breath, with one decision. Now it's your turn. Which of these movements will you try first? Leave a comment and let us know. And if this video opened your eyes, don't just watch, subscribe, activate notifications, and share it with a friend who needs this message. This isn't the end, it's the beginning of something powerful. Your next chapter starts here.